Hello. This is Dr. Ahmed Al-Magable. Welcome again to OET Professor course. In this part, we will talk about part A in reading. But first of all, we will have a skimming to the whole part instruction. In the three parts, you will be given sharply 1 hour to answer all the questions. In part A, it will be separated from part E, B, and C. In part A, you will be given 15 minutes to answer 20 questions. Okay, to answer 20 questions. This is very important. So you will be given two handbooks, one for the answer sheet, and the other one have this four text: text A, text B, text C, and text D. Text C and text D. Okay. Then you will start. Then in the other handbook, you will have the question sheet, 20 question sheet. The 20 question sheet will be separated. The first 6 or 7 is talking about what is this sentence from what is the subject of the sentence, where it can be found in text A, B, or C. You just have to put A, B, C, or D. And in the other 7 and from let's say from 8 to 20, you will have two forms. One is filling gap question, and the other is a question is a direct question like this. Okay. There is a lot of non-truthful, let's say, and non-experienced instructor who is telling you that just go to the 8th one. This is very wrong. As I've learned from the OET official site, that you have to begin with the first question, second question, third question, and etc. Okay, you should not just skip to any other question before you have tried to solve the previous one. Okay, you have to notice what I've said before you have tried. So you have to do the two important thing that, of course, if anyone have listened to the previous videos that in listening, I have talked about two things that you have to use: time control and damage control. Time control and damage control. This is super important thing that you have to use in this part. Okay, in this part you will be examined for your skimming reading. This is very important. And also for the people who listen for my previous videos, he will learn about something that I've talked about, in that how you make your brain absorb, how you make the drink, how make it drink the test, how make it drink the idea and the concept of the text by beginning, and you will laugh on that, by beginning in the title of the text. So the texts will be talking about tetanus, and the fortunate thing is that all the texts will talk about the same topic. Okay, all the texts will talk about the same topic. So how would you deal with it? In the 15 minutes that you will be given to answer the question, to answer the 20 questions, which are all found in this 4 subtest, in all these texts, you have to use the skimming reading to read all these texts in approximately 1.5 to 2 minutes. This is very super important. What, doctor? But in 1.5 minutes? Are you serious? Yes, I am serious. And how is that? That is just by giving each text a definition for its a whole definition. Sometime you may or a title. What I mean by definition is a title. You just give it as a whole. Sometimes it's very easy that you can give it all the text. You can give it a title, or sometimes you just give it give a title for a specific for the specific paragraphs. Okay, what I mean by that is that just like this, tetanus is a severe disease. Okay, this is definition. Tetanus is about is definition and the cause of bacteria. This is the first one. Okay, then I go early symptoms of tetanus. I can give all of this a title of symptoms, right? So then in this paragraph I just read it in a skimming way. So complication, pneumonia, broken bone, etc. So this is about complication. Okay, there's no specific diagnostic laboratory test, so this is about diagnosis. Okay, then I go. How much it took from me? Less than 10 seconds. Then I go. Then I give it. Then I give a definition or a title. For each thing that I can minimize my search. So tetanus is an acute disease induced by toxin tetanus bacilli. The spores are present in soil. So I will where it can be found. Tetanus prone. So this is all about risks, right? Isn't so? What it make it more risky? I give it more risky. Okay, so I go to the next one. Intravenous are greater risk, either opportunity they can. So this is about intravenous. Booster doses can be given. Okay, immunocompromised patient may not be adequately protected, so I can give both of them special things that increase its risk, right? Intravenous, I can just give IV and immunocompromised. Then I move on. Okay, this is very super important in what I will talk about right now. When I found a scheme or a schedule table, what I mean is a table. Skimming is that when you have skimming, you know what skimming is, and or a table like this. I feel so happy. Why is that? Because it's so easy that you can give it a title. Okay, so this is about I can give it vaccine, right? But what is, as I told you, you have to read all the information to give it a title in a skimming way, with an exception for one circumstance. And what is that? This is very super important. Please focus me on that. You have to read the sentences or the sentence above or below the schedule very thoroughly. This is the only circumstance that you have to read in part A in thoroughly way in the 1.5 minutes. Okay, this is very super important because it's almost in every OET practice test and every OET test in the past year, not just in the past few months. They always bring a question or two or even three, sometimes three, from the information that is above or below the schedule. Okay, and why I'm insisting that you have to read it very thoroughly, because sometimes they mention something that it can be somewhere else. Okay, maybe they will talk about risks, and we talked about risk in part B, but the question will be very pointed to this 3 point. I'm just giving an example. Maybe they are not talking about the risks, but I'm putting it as example. So you have to read the information above the schedule or scheme or and beneath of them, you have to read it very thoroughly. So thorough cleaning of the wound is essential irrespective of the immunization history of the patient, and appropriate antibiotic should be prescribed. So this is about cleaning and antibiotic. Then I go. Has notes, has received a total of 5 doses of vaccine, appropriate interval, heavy contamination with material likely to contain tetanus spore and or extensive devitalized tissue. Immunosuppressed patient present with tetanus spawn wound should always be managed if they were incompletely immunized. So the only things that you have to read it thoroughly again is the information above and below the table of the or skin. Then again, this is another table. This is about human tetanus immunoglobulin in a particular way. Sorry, I will make it. Okay, just a second. Okay. This is specifically about human tetanus immunoglobulin. So I give it a title of this. This is indications of HTIG, and this is the doses, okay, available in one ampule containing. Because I always say that you have to read any information above or below the schedule. So you read this information. Then this is about doses of HTIG. Then you go in beneath, and you should not even skip this. This is very super important. They always play on that. They always play in your site. Sometimes they just bring it in very small letters so that you can skip it. Due to its viscosity, HTIG should be administered slowly using 23 gauge needle. Contraindication, this is, you can give it contraindication of HTIG and adverse reaction of HTIG. This is very super important. Now you go to the first question. This should not exceed 1.5 to 2 minutes. Okay, the types of injury that may lead to tetanus. Okay, what is it mean about risks? Risks in which part? In part B, right? Types of injury. We are talking about types of injury, so it's in B, right? It's about risks. So the next one. So this is P. Signs that patient may have. What is the signs? It's in A when I give it. Sorry, it's in A when I give it. A title of symptoms, right? Okay. How to decide how to decide whether a tetanus vaccine is necessary. How to decide? It's in the schedule of this vaccine, right? Right? So it's in C. It's in C. So an alternative name of tetanus, this is in definition, so it's I'm very sure that it's in A, even without I go back to it. Possible side effect of particular tetanus medication. The only medication that it has its side effect is HTIG, so it's in the end one. It's D, right? So the next one, other conditions which are associated with tetanus. It's about complication, right? It's about complication. Where the complication we have given in part A. This is very super important. Okay, so it's in part A. This is this first 6 to 7 question are very easy, and most of people will not find any problem to solve them, but the challenge is the rest 12 question. Okay, how you have to deal with them. There will be no difference if there is filling gap or die question like those question, because you have to use this method. Okay, This method is within two scale. The first one is that you have to read the question and decide where is it. It's very important. You have to decide where is it. After you decide where is it, you have to take a keyword and you just have to make your eyes to look after this keyword or what is or in a synonym of it. Okay, so it's very important. You have to be very smart in how you are searching for it. So as example, if patient has been touching what on or earth, they be more susceptible. So this is about risks, right? So this is about risks. Risks is mostly in part B. So touching what or earth, they are more susceptible to tetanus. Let's see. So so I told you it's in B. Of course, you will be much faster because the material will be, you have to print it down so you can practice it more efficiently. But as I told you, I will look for earth or something that is synonym to it. Okay, so tetanus, okay, are present in soil. Okay, in soil. But is there anything that except of the soil? No. So I go and I skim reading. Significant degree, no. Puncture, okay, let's see. Puncture type, particularly with soil or organic matter. So what is the answer? Is organic matter. Is as simple as that. I go and I answer it, organic matter. You will be surprised that when you go through the question more and more, I mean when you reach 12 question, you will be almost your ability to find the answer would be much higher because you will know that each paragraph what is talking about generally. So you will skip it until you reach the paragraph that is meant. So let's move to the other one. Any lodged in the site of injury will increase the likelihood of tetanus. Again, it's risk factor. And what has to be lodged? Has to be lodged? Let's see. Has to be lodged? It's so. And firstly, I decided it's in part B. Then I have to look and what it has to be lodged so that it can increase the risk of injury. Let's see. Okay, no, because any wound or burn integral is following characteristic. No, this is, I will not find it here at all. Any one from compound? No. Containing, okay, any one containing what? Foreign bodies. So the answer is foreign bodies. Then I go and move to the other one. Patient with what fracture? Okay, you have just read fracture. That is how you smart, okay, and how you practice, okay. You find it very easy because what kind of fracture is compound, right? Because you have just read the text, so your ability to find it will be much easier. And I want you to know that you have to do something which is damage control as one. If your first decision, if you did not find the answer in 10 to 15 seconds, just skip it. Why? Because there is much easier question that you have to recap before the end of the time. So this is very super important, doctor. If you left 2-3 gaps, it's not important, because your minimum score should be 17 out of 20 or more. Okay, of course you can even get the full score, but your aim or your damage control should be between 17 or more. Let's continue. Delaying surgery on an injury on burn by more than what? Increase the probability of tetanus. So I'm looking. So this is about also about risks, and I'm looking for a time. So I go back. I'm looking for a time. Now you are I think that you are getting more interactive with it. So I'm looking for a time. Surgical intervention is delayed for more than 6 hours. So 6 hours. My answer would be 6 hours. Then I go back. If burns patient has been diagnosed with what, they are more liable to contract tetanus. To contract tetanus. So it's mostly also in text B. So what has been diagnosed with will make them more reliable to more let's say they're more reliable to get the tetanus. Okay, let's see. Okay, significant district degree. No, it's not in here. It's not in here. This is about combined. This is about foreign. Okay, okay, let's see. Patients who have systemic sepsis. So my answer would be systemic sepsis. Who has been diagnosed with systemic sepsis will have a higher degree to get tetanus. Okay. Patient who is or regular recreational drug user will be at greater risk of tetanus. Okay, we are also talking here about risk of tetanus. It's B. Recreational drug. Okay, recreational drug. Let's continue. For now, we knew that the answer is not in the above sentences. So I just read. Keep reading. Anyone from 2-3 implantation. Okay, this is the recreational drug user. And what is the else? Every opportunity. Okay, poster to the immunization state. Immunocompromised. So it's immunocompromised patient. The answer would be recreational drugs and immunocompromised patient. Okay, this is two important things. And what we have noticed that sometimes as I told you, you have to make your mind opened, not closed, because when you understand what is the question particularly want, you will find the answer very easily. So clean the wound thoroughly and prescribe what, if necessary, followed by tetanus vaccine and HTIG. As I told you, what is talking about cleaning? I told you the only situation that I had to read thoroughly, it's just above and below, because they always bring a question from it. This is about cleaning, right? We knew that it's cleaning is above the hair. Anything about treating is above the hair, and what should be prescribed is antibiotic. So the question is antibiotic, and it's very important to write the word, all words, as they are in the text, even if they have a higher letter. Okay, please concentrate on that. So we move to 14, where do not read any, do not spend any of your time reading the question and whatever. You're not that naive to waste your time on that. Where will patients suffering from tetanus first experience muscle contraction? So this is about symptoms. Then I go back, and I know that the symptom is in A. So where first experiencing, then I took my keyword first, muscle contraction, where he will experience. Of course, anyone in the medical field, especially medical doctor, he will know it's in jaw, but I want to show it in you. Okay, no, I need to read it as much. I want to read it exactly as it in question. I will not take the jaw because it's written right here. No, because there's nothing indicated that it's the first thing in muscle contraction. So I keep just reading. It's in the symptoms, right? Pain for muscle contraction that begin in the jaw. So the answer is jaw. I go and I answer it jaw. The next one, what can muscle spasm in tetanus a patient sometimes lead to? So this is complication. Complication is also in part A. I go This is complication, including pneumonia, broken bone from muscle spasm. So what it can lead to? Broken bone. Okay. You see how fast I am in finding, because I have given everything a title. So if you test the tetanus using spatula, what type of reaction will confirm the condition? So we are talking about diagnosis, right? So I go back to diagnosis in part A, and I will see what I can use by spatula. The spatula test is useful, touching the back interference, elicit bite reflex, so instead of gag reflex. So what is the positive sign? Is bite reflex, and that is my answer, bite reflex. Then I go back. How many times, let's see, how many times will you have a vaccine to vaccinate patients who need full course of vaccine, of tetanus vaccine? I told to you that you have to read it, that you have to read any information above the question, above the schema schedule, or beneath it very thoroughly, because you will know the answer that is just in the vaccine. You receive a total of 5 doses. How many doses? 5 doses. Then you go back. Then you go back. What should you give a drug user if you are uncertain of their vaccination history? What you have to give a drug user? What you have to give a drug user if you are uncertain about his drug history? You can find it here in the schedule, or in the thing that you are very certain, that is talked about IV drug user, right? So every opportunity should be taken to ensure booster doses should be given if there is any doubt of their immunization. So what should be given? Booster. Okay. Let's see. Question number 19. What size of needle should be? Now this is the question that I'm talking about. That sometime play in your mind, so you can skip it. Okay. So you can, to inject HTIG, what size of needle? What size of needle? Where we read the size of needle is just beneath the schedule. It's just beneath the schedule, right? 23 gauge needle. 23 gauge needle. Okay, that is the answer. What might patient who experience an adverse reaction of HTIG be unable to stop doing? So adverse effect, we have give it a title in the end of HTIG. So what he can't stop doing, then I go back. This is about adverse reaction. What he can't stop doing, hypotonic episode, persisting crying. So he can't stop crying. So my answer would be crying. Okay. Sorry. So I hope that everyone had benefit from this. Of course, we will practice more and more in our free session, in our online live session that will be recorded, and you will have access to it for 3 months. So please do not you have to attend to our live courses so that you can practice with me directly and give and to get the feedback. Before the online session, live session, please practice and sharpen your skill. This skill, it need to be sharpened very thoroughly, very deeply. Okay, so that and use the skill that I've given you, so that you can get the highest mark that you can. Okay, and please just put a timer of 15 minutes while you are practicing. So I will see you in the next video.